Our opening game of the 34th season of live high school football on Cox 7 between Saguaro and Centennial. We are thrilled to have Dr. Stephen M. Erickson from the Banner Sports Medicine and Concussion Center with us. And Doctor, first off, great to see you. Great game we've had a chance to witness so far. And of course, concussions have been in the forefront for the last 2 or 3 years, specifically gaining so much notoriety and attention. With your involvement and that of Banner, how much, because of that attention, have you seen the awareness improving the diagnosis and how it's being treated out there in the field and also at home with the parents?
Yeah, the press regarding concussion has been fantastic because it used to be that a lot of sports-related concussions went undiagnosed, unrecognized, and parents and coaches and kids just didn't know what to look for, and so a lot of concussions got neglected. Now, with the increased awareness, we're seeing a lot more players knowing that they shouldn't be playing with a concussion, a lot more parents and coaches being aware of that, and getting those kids in to be evaluated by somebody for their care sooner rather than later.
Well, I know there's so much information available online, but let's say we've got a viewer that still doesn't know what the signs are. What should that parent look for in terms of their son or daughter having experienced some of these?
Yeah, it's pretty simple for a parent, especially since they know the kids so well. But really, every head trauma is not a concussion. We witness multiple head traumas during the game already today. But any head injury or any head blow that results in symptoms, albeit temporary, headaches, nausea, dizziness, difficulty concentrating, any neurological symptom that persists should be suspected as a concussion until proven otherwise, and get them in to be evaluated.
Research continues on a daily basis, but what are the long-term effects of a concussion if it goes not only undiagnosed but untreated?
Yeah, so the undiagnosed and untreated in the pediatric age group, the young kids, is really scary because you can have second impact syndrome, albeit rare, but more often when you have a head injury and you don't get treatment and you have another head injury before you've recovered from the first one, your symptoms are going to last a lot longer. There's going to be a prolonged recovery. It may take months to recover as opposed to 2 or 3 weeks for your regular concussion.
So what is the baseline testing and who should be getting those tests done?
Yeah, so baseline testing is a critical piece in the evaluation and treatment of concussion. It's doing a snapshot of what their neurologic function is like before they step on the field. So we have an extensive program working with a lot of club sports and high school athletes in the state to do baseline testing so that cognitively and balance-wise we know what their function is like, so that if and when they get concussed, we know what normal is for them. So we really know what their normal baseline is, and we've gotten them completely recovered before we put them back on the field.
Of course, Banner, I would assume, does much more than just concussion testing. What are some of the other sports-specific injuries and areas that you treat and work on with patients?
Yeah, so Banner, we have an extensive sports medicine network, and Banner, we don't just the Banner Concussion Center. We've changed our name. We're the Banner Sports Medicine Concussion Center because I'm board in sports, and we take care of every sport injury out there, from ankle sprains to knee pain to back pain to asthma. Anything that's sports-related in athletes, we're the place to go.
All right. Well, Doctor, thank you for stopping by, and certainly thanks to Banner Health and Sports Medicine specifically for all the information and the treatment that you're providing for the fans out there. All right, stay with us. Our halftime coverage continues. Saguaro Centennial here from Glendale Community College here on Cox.